Hi, my name is Kamika Williams, and today I'm going to be presenting the usage of ultrasound in the radiation therapy field. Ultrasound can be used in several ways: localization of tumors, planning of the radiation treatment plan, monitoring of the treatment response, real-time guidance of the radiation therapy, localization of tumors. Ultrasound is one of the most commonly used imaging modalities for detection and localization of tumors. It can be used to locate the tumors and the surrounding healthy tissues. It can be used to evaluate breast tumors as well as tumors in the liver, pancreas, and kidneys, prostate. Ultrasound does not involve the exposure of ionizing radiation to the patient. The use of ultrasound in planning in the radiation field. Treatment planning helps to determine the size, the location, and the shape of a tumor. This information can be used to create a treatment plan that targets the tumor with eye precision and minimize the radiation exposure to the surrounding healthy tissues. Image-guided radiation therapy, IGRT. It tracks the movement of the tumor during treatment, monitoring the position of the tumor in real time. Radiation therapists can adjust the radiation beam to ensure that the tumor receives the intended dose. Also with brachytherapy, which is a type of radiation where the radioactive source is placed inside the body's cavity close to the tumor, such as the implantation of seeds in the prostate. It can help to guide the device to make sure that the seeds are planted in the correct location. Ultrasound can also be used to guide the placement of the radioactive source and ensure that it's positioned correctly. High intensity focused ultrasound. It's the use of intense heat by the waves from the ultrasound that helps to destroy the cancerous tissues. It permits a non-invasive treatment of various benign and malignant solid tumors, such as liver cancer, renal, prostate, uterine fibroids. It can alleviate the cancer-related pain without any significant complication. Monitoring of the treatment. Cancer. It can be used to monitor the size and the growth of the tumor in areas such as the breast and prostate cancer. Cardiovascular disease. It can be used to monitor the function of the heart and blood vessels, assess the effectiveness of treatment such as medication or lifestyle changes. So for instance, if the physician prescribed the patient with medication for whatever issues that the patient have, you would want to later on also image again to make sure that that medication is in fact doing what it's supposed to do. And also, if the physician advised the patient to make lifestyle change, you would want to, if the patient implement those lifestyle changes, we'd want to also image further along to make sure that those implementations that the patient made is is in fact showing progress for whatever treatment that the patient is doing that for. Musculoskeletal. So you can use ultrasound to visualize, like to make sure that if the patient suffers from a fractured bone, to make sure that that bone is healing correctly. And for sprains, strains, tendonitis, arthritis, ultrasound helps to guide the injection of steroids into the joint. It's for pregnancy. Ultrasound is used to monitor the health and the development of the fetus during pregnancy. It can detect when any abnormalities or potential problems in the early stages of the pregnancy. It can track the progress of the fetus throughout the pregnancy. It also determines the inception time period and the estimated delivery date. Real-time guidance. Ultrasound used in the medical settings to guide procedures such as biopsy. Ultrasound can help to guide the placement of the needle to take samples of tissues for biopsy. The image provided can help the physician to visualize the tissue in question and ensure that the needle is placed accurately, which helps minimize the need for multiple attempts and reducing the risk of complication. Yet again, ultrasound is minimally invasive injections. Ultrasound can be used to help guide the placement of needles for injections such as epidural while the female is delivering her baby, or joint injections with the steroids. Surgeries. It can be used in laparoscopic or minimally invasive surgeries where small incision is made. And the photo here is it's a needle biopsy of the kidney. All right, thank you.